your view, is this the right time frame? Plan B, over and done with, and as we emerge from the winter, getting rid of those last remaining restrictions as well?
Yeah, afternoon, Tom. I think so. Obviously, remember last July we said we were going to have to learn to live with COVID, and then we got into the winter months and we started seeing that big spike. But the large number of cases that we've seen over the winter has been driven obviously by the Omicron variant. Now, the Omicron variant itself has kind of been the game changer in the pandemic, because whilst we now know, and we were getting some early evidence of this out of South Africa, that it's a far more transmissible variant, it clearly is less deadly, because if you look at the number of patients in hospital, we get statistics every week. Half the patients in England's hospitals are in with COVID, but not because of it. And that's significantly up on what we had with the Delta variant, where COVID was predominantly the main reason why patients were going in. And we're seeing the same thing now with people on ventilators. That never really rose at all during the winter months. It crept up a little bit, but very marginally, not compared to anywhere near what we saw with the cases. And they're coming down at the lowest point since July as well. So I think the question really in terms of living with COVID and what the Prime Minister's talking about, that we don't self-isolate with the flu, is that you remember now, before COVID, we always had pressures on the NHS. So I think the question really needs to move on, not about learning to live with COVID. It's what can the health system what does the health system need to deliver in a normal winter, so that next winter, regardless of any variant of COVID or flu, that the NHS won't be kind of saying and panicking that we need to put some restrictions in to stop the NHS getting overwhelmed. I think that's the critical thing for the next 7 or 8 months as we go into next winter.
And I suppose there's a difference here in between what the definition of being overwhelmed means. Clearly, there were lots of healthcare professionals who had a pretty tough time and have been having a pretty tough time over the last few months. Omicron did produce a few thousand more hospitalisations than we would have liked, but it didn't collapse the NHS. And is that an important distinction?
No, I think so. Actually, if you look at the number of patients in critical care, so let's put COVID to one side a sec. If you actually look at the number of patients in COVID over this winter, it's actually been lower than what we had pre-COVID. Now, we did have a massive spike last year, when we is what it was formerly known. We had a huge spike last year, huge pressure on the NHS. But this year, we haven't. Now, in part of that might be that, some patients haven't been admitted for elective surgery, which has helped keep kind of the pressure down. But we haven't seen that big spike. So, yeah, what is the definition of overwhelming the NHS is going to be a critical thing as we move forward in the debate, because cancer operations were being cancelled pre-COVID during the winter months. Ambulance delays were occurring. So I think Boris is right. We can't continue with self-isolation forever. New variants may come, and they may change the game again. But history would say, especially with the flu, when we look at the Spanish flu 100 years ago, these variants kind of learn to become more transmissible but less deadly to survive themselves. So if Omicron continues the way things are, I don't think we should really be looking to self-isolate for something where the vast majority of people don't get seriously ill at all.
It seems as if there's been a sort of change in consensus, really. I was reading a piece by a medical professional in The Guardian just this morning suggesting that now is the time to live with COVID. The Labour Party not outright opposing the government's announcement on this either. Do you sense that there's a greater form of consensus in this country now, that this is the time to complete the pandemic?
Yeah, well, if The Guardian are writing things like that, Tom, there's clearly been a shifting kind of attitude, because they're normally the ones kind of pushing for further restrictions and the like. And the facts don't lie. If you're looking at them, we're seeing the lowest number of patients seriously ill since July. The deaths figures as well now, you've got to treat with very extreme caution the daily figures that we get, because remember, they're deaths within 28 days of a positive test. Now, they're kind of running around between 200 to 300 a day at the moment. But when you actually look at the ONS figures on deaths, where the death certificate says it's specifically because of COVID, it's around 100. Now, obviously, that's 100 tragic deaths, but to put that into kind of context, that's around about 5.86% of all the deaths. The significant people die every single week. And as we move forward now, and the cases are starting to come down, just like they did in South Africa, there are some green shoots out there. We can't continue, obviously, to impose restrictions, because there's the other effect of people's mental health. So I think now is probably the time. Other parts of the devolved nations aren't following suit as quickly. That potentially could be political. But, I think I did say a few weeks ago that by February we should be over the worst of this, and it's looking extremely likely on that as well.
Well, let's hope this was the last COVID winter dominated by COVID. Jamie Jenkins, thank you very much for joining us.